Hello everyone, welcome to the Medic World Study with Dr. Mahi. Today we are going to discuss the previous year questions of NEET PG 2022 of the subject Anatomy. So let's start with our first question, that is, the structure marked A in the image below gives rise to which of the following structures? What is the structure marked A? In the given image, the structure which is marked as A is the ventral mesentery, and we all know that ventral mesentery gives rise to all the ligaments related to liver. So let's see the options. In the given options, the only ligament which is related to liver is the falciform ligament. So the answer to this question is option C, that is falciform ligament. It arises from the ventral mesentery. Now, the next question. A patient underwent surgery for varicose vein. He now complains of sensory loss over the medial aspect of the leg and foot. Which of the following nerves is most likely to be injured? As per the given clinical scenario, there is sensory loss over the medial aspect of the leg and foot. This points to the diagnosis of injury to the saphenous nerve. So the answer to this question is option D, that is saphenous nerve. Now the next question, identify the cartilage given below. In the given image shows the prominent collagen fibers arranged in bundles and with intervening rows of chondrocytes. This is suggestive of white fibrocartilage. So the answer to this question is option D, that is white fibrocartilage. Now the next question, a patient presents with a unilateral throbbing headache, photophobia, and excessive lacrimation. He also complains of hemifacial pain on clenching of teeth. On examination, pupillary reaction, light reflex, and accommodation reflex are normal. Which of the following marked nerves is involved in the above scenario? Let's first diagnose the condition. Unilateral throbbing headache, photophobia, excessive lacrimation, hemifacial pain, on clenching of teeth, all of these points towards the diagnosis of trigeminal nerve damage. Let's see the image. Here in the image, the nerve, this is the trigeminal nerve, which is the thickest one, and it is marked as 3. So the answer to this question is 3, that is option C. Now the next question, identify the given structure. In the histopathological structure given, we have to identify the structure, and the answer to this question is option D, that is pancreatic islet cell. Today we are going to discuss the previous year questions of NEET PG 2023 of the subject Anatomy. So let's start with our first question, that is, a defect in which of the following forms the structure marked below? The structure which is marked here is the deep inguinal ring. And it is formed by the defect in fossa transversalis. So the answer to this question is option D, that is fossa transversalis. Now the next question, a student had his jaw locked while yawning. Which of the following muscles is attached to the articular disc of temporomandibular joint? So, the answer to this question is option A, that is lateral pterygoid muscle, because it is attached to the articular disc of temporomandibular joint. Now, the next question, identify the structures in the following histological image. Here in the histological image, we can identify the structure as glomerulus. So the answer to this question is option D, that is glomerulus. Now the next question, injury at which of the following marked sites causes failure of dorsiflexion? Here, in the X-ray given, we all know failure of dorsiflexion, that is foot drop, is caused by the damage of common peroneal nerve, and it passes through the neck of fibula. So the marked site here is marked as 3. So the answer to this question is option A, that is 3. Now the next question, a defect in which of the following aortic arches causes the defect shown in the image? The defect which is shown in the image is of patent ductus arteriosus, and it is due to the defect. It is a patent ductus arteriosus, and it is due to the defect on the left side of sixth pharyngeal arch. So the answer to this question is option D, that is sixth left pharyngeal arch defect can cause this damage. Now the next question, which of the following structures develops from the structure marked as A? Let's see the image. The structure which is marked as A is the allantois, and its distal portion forms the urachus, which in turn gives rise to median umbilical ligament. So the answer to this question is option B, that is median umbilical ligament. Now the next question. A patient comes with abdominal pain, jaundice and portal hypertension. Abdominal pain, jaundice and portal hypertension. Anastomosis between which of the following veins is seen? So, in the given clinical scenario, in a patient with portal hypertension, anastomosis between the esophageal and left gastric veins can be seen. So, the answer to this question is option B, that is esophageal and left gastric veins. Now, the next and the last question is, a patient presents with a swelling under the left ear lobule and complains of pain. Which of the following structures is the likely cause of the pain? The cause of the pain in this patient complaining of pain in the parotid region is likely to be the greater auricular nerve. So the answer to this question is option B, that is greater auricular nerve. Thank you so much.